So what is auditory system? How do we listen? What nuclei, what tracts are involved? In ENT we studied what all that happens inside the ear. But once the inside of the ear produces the electrical impulses through the cochlear nerve, how it is communicated ultimately to the auditory cortex in the brain is all about the auditory system. So our auditory system is an exteroceptive special somatic afferent system which brings the information about the hearing. Hence it is called special somatic afferent system. What is the normal frequency humans can talk, doctor, can perceive the sound? 20 to 20,000 hertz. Ordinary conversation which we all speak will be between 300 and 3000 hertz. And typically the auditory system functions in a intensity range of about 120 decibels. These numericals have got a role to be remembered. Then 1 decibel and 2 decibel, between the two, the intensity discrimination is possible for our auditory system. I mean, such a fine discrimination of the intensity is possible. We can differentiate sa from re, from ga from ma, sarigama padanisa. So we need to be very sure. Then in few people it is very well developed, gifted at birth. Few people in spite of practicing can't sing. So then there is a tonotopic localization at all the levels of neuraxis. So you can be very sure whether the other person on the telephone is your boss or your wife or your husband or your child who is giving a distress call when you are in hospital. So that pitch localization is possible at all levels of the neuraxis. What is presbyacusis, doctor? It's that loss of the high frequency tones to perceive with the advancing age becomes the presbyacusis. Very good. We have Dr. Gaikwad from Pune, who little better late than never, whether it is love or war. So at least I am happy Gaikwad came little late to the class, but he is in the class. So presbyacusis, even in entrance preparation, that is the rule, doctor. If you are going for an exam, better late than never. Don't give up altogether. Then I am failing in my job. Now, where will the auditory pathway begin? There are in the organ of Carti hair cells. They are innervated by the peripheral process of the bipolar cells of the spiral ganglion. Just like trigeminal has a ganglion. Everybody nowadays is having ganglion while receiving the afferents. Then cochlear also asked the god, "Arey, what sir? Hearing ke liye kuch ganglion hona chahiye." There must be a ganglion, and that is the spiral ganglion. Now there are two types of hair cells. Inner hair cells, which will basically innervate and synapse with numerous afferent fibers, each of which will make contact with only one hair cell. And majority of the fibers in ultimate cochlear nerve, they are basically received from inner hair cells, not outer hair cells. Right? This can sometimes be a good question of the examiner. It is the inner hair cells fibers which are the major part of the cochlear nerve. Then outer hair cells, basically they outnumber the inner hair cells by 3 to 1. 3 outer hair cells per 1 inner hair cell. And they in turn will synapse with many other outer hair cells. So in summary, this is a typical picture of outer hair cells, inner hair cells, the basilar membrane, and the nerve fibers which are coming, which are the afferents from the hair cells. Then all of them, where are they reporting to doctor? The spiral ganglion. From the spiral ganglion, your cochlear nerve will arise and it will continue towards the brain. So the bipolar cells of the spiral ganglion, they project peripherally to the hair cells of the organ of corti and centrally to the cochlear nerve, as the cochlear nerve ultimately to the cochlear nuclei located in the medullopontine junction. So between the two you are having this spiral ganglion. It is receiving the fibers from the hair cells and projecting ultimately to the cochlear nuclei in the form of cochlear nerve. But the cochlear nerve predominantly contains the inner hair cell derived axons rather than outer hair cells. So the outer hair cells outnumber the inner hair cells by 3:1. Okay, doc. Now, if you look at our basilar membrane, it is like a string of veena or any musical instrument. Different vibrations are perceived by different parts of this basilar membrane. So, if you look at the basilar hair cells, the basilar membrane's hair cells, in the basal part of the basilar membrane, they perceive around 5000 hertz. Whereas the apical part, hair cells will be perceiving 50 hertz. So that way, the sound, depending upon the frequency of it, will be reporting to different parts of the basilar membrane, which are picked up by the hair cells, and in turn they will be sent to spiral ganglion, and from spiral ganglion through the cochlear nerve they will be reaching the cochlear nuclei, which is located in the brainstem. So where is the cochlear nuclei? Where are the cochlear nuclei located, doctor? They are located in the medullopontine junction. Now let's talk about cochlear nerve. So from where to where cochlear nerve is extending? From the spiral ganglion to the cerebellopontine angle at the pontomedullary junction, where it enters the brainstem. Then what are cochlear nuclei? Typically they are the only auditory nuclei. They do not receive the binaural input and the entire neuraxis of the auditory system. See, what are the various components of the neuraxis of the auditory system? Cochlear nuclei, trapezoid body. Then you are having inferior colliculus, lateral lemniscus, medial geniculate body, and ultimately auditory cortex. In this hierarchy, other than cochlear nuclei, everybody else in this hierarchy receives information from both the ears. Binaural input will be there, except for the cochlear nuclei, which are receiving only from that ear through the cochlear nerve. Right? Cochlear nerve is not decussating and sending fibers to the other cochlear nuclei also. No, it is not sending. Only to the ipsilateral cochlear nuclei it will be sending. Hence, any lesion which is involving the cochlear nuclei will lead to unilateral deafness. God don't want to make you deaf both the sides, both the ears. Now, there is one small tricky point about cochlear nuclei which you need to be very, very sure about. Dorsal cochlear nucleus versus ventral cochlear nucleus, what is the main difference? Basically, the dorsal cochlear nuclei, if you take, they underlie the floor of the fourth ventricle. They receive the input from the cochlear nerve and they project directly to the contralateral lateral lemniscus. Right? Then quickly tell what is the difference to the ventral cochlear nuclei before we forget. Ventral cochlear nucleus, it also receives the input from the cochlear nerve, but it will be projecting not to the contralateral Where did it project? Contralateral lateral lemniscus, it directly jumped and projected, no? Dorsal cochlear nucleus. Ventral cochlear nucleus is not like that. It will be projecting bilaterally to both superior olivary nuclei. Right? And in addition to that, it will also project contralateral lateral lemniscus also. And typically it will be giving rise to, while decussating to the other side, the ventral cochlear nuclei will be giving rise to the ventral acoustic stria, which is basically called trapezoid body. So that is the difference. What is the difference? Dorsal cochlear nuclei will directly jump and communicate with the contralateral lateral lemniscus. But ventral cochlear nuclei will be communicating to bilateral superior olivary nuclei and also to the contralateral lateral lemniscus is what you need to remember. Let us see. Typically you have two types of cochlear nuclei. You have a ventral and also dorsal. So what is ventral doing, dorsal doing, doctor? Dorsal is directly communicating to the contralateral lateral lemniscus, but ventral is decussating and forming the nucleus of trapezoid body and communicating to the opposite and also ipsilateral superior olivary nuclei, and also additionally it is sending the fibers to the contralateral lateral lemniscus. This is once more. This is the dorsal acoustic, dorsal cochlear nucleus, doctor. This is a spiral ganglion which is leaving the fibers to the cochlear nuclei, and here you are having what? Dorsal cochlear nucleus. Here you have ventral cochlear nucleus. What did dorsal cochlear nucleus did? It has crossed the midline and contributed fibers to the contralateral lateral lemniscus. Whereas the ventral cochlear nucleus has sent the fibers to ipsilateral superior olivary nucleus, contralateral superior olivary nucleus, and also the direct fibers to the contralateral lateral lemniscus. That is the difference between ventral and dorsal cochlear nuclei is what need to be remembered. Once you know this, everything else is nothing in neuroanatomy of auditory system. You understood everything. So where is the superior olivary nucleus? Superior olivary nucleus is in the pons where the facial nerve nucleus is located. At that level, you have the superior olivary nucleus. From where is it receiving the information from? Not the dorsal cochlear nuclei, it is receiving from ventral cochlear nucleus. Where will it be projecting to? Both ipsilateral and contralateral, both side lateral lemnisci it is projecting into. Right? And what is its importance? Why it need to receive information? The sound localization. Is the sound coming from distance, from the nearby, or is it your boyfriend or girlfriend crying directly under your ear? How closely they are keeping their mouth and shouting into your ear, everything will be known to superior olivary nucleus. Then what else? Once it receives information, it will typically give rise to efferent path. You may say, what is this sensory system? Efferent path is too much. That means if somebody shouts and your ear reports to the brain, brain in turn reports to the ear, is too much, no? Right? So that is called olivocochlear bundle. It is a cochlear feedback pathway. Once cochlea generates electrical impulses and reports about the sound and localized sound, the intensity, pitch of the sound to the brain, in turn, olivary nucleus, superior olivary nucleus which received it will send back the information back to the cochlea. Why is this required? Basically, this cochlear feedback, once more the cochlea receiving the impulses from the olivary nucleus, will bring the sharpening to the hearing. Sharpening to the hearing is a phenomena which is mediated because of this audibo-cochlear feedback, which comes back to the cochlear nucleus. So summarize, doctor, you have a ventral and a dorsal cochlear nuclei, superior nucleus, lateral lemniscus, inferior colliculus, middle geniculate body, auditory radiation, and superior temporal gyrus. Then what is trapezoid body, doctor? Same story. Typically in the pons, caudal part of the pons, tegmentum, in the floor, at the level of the abducens nucleus, you have the trapezoid body. So what does it basically contain? It is at the level of the abducens. So the abducens nucleus will be giving rise to abducens nerve. So those intraaxial abducent fibers will also be passing through the trapezoid body, and also it contains the decussating fibers from the ventral cochlear nucleus which are traveling towards the contralateral superior nucleus. Then what is lateral lemniscus? It basically receives the input from the contralateral cochlear nucleus. It also receives the input from the ipsilateral and contralateral superior nucleus, and it is connected to the even to the contralateral lateral lemniscus by commissural fibers. So much information is being transmitted into both the ears, right? Then it ultimately projects to the inferior colliculus. So what is inferior colliculus, doctor? It receives the information from the lateral lemniscus, and it will be ultimately projecting to the medial geniculate body is what the inferior colliculus will be doing. Then one more thing inferior colliculus will do. Whenever we listen the sound, we turn our eyes towards that side. Inferior colliculus is associated with audition, but superior colliculus is associated with vision, no? So it will also send some fibers to the superior colliculus. Inferior colliculus will do that, so that there is a coordination between what we are listening and what we are seeing. So that is the beautiness of the system. So once more, cochlear nerve, cochlear nuclei, then inferior colliculus, medial geniculate body, and the temporal cortex. Then what is medial geniculate body? Medial geniculate body typically is located in the thalamus, the part of the thalamus which is dedicated for the receiving of information, audition. That's called auditory thalamus. There the medial geniculate body is basically located. Colliculi are located at the level of midbrain. Olivary nuclei are located at level of, if it is superior olivary nucleus, it is in pons, and inferior olivary nucleus is in medulla. Right? Then, so it ultimately projects to the auditory radiation, the primary auditory cortex. Where is it located? First day we discussed gross anatomy of the brain. So transverse gyri of Heschel, which is the area 41 and 42. And medial geniculate body also will project some fibers to the amygdala. Why? Whenever you listen a beautiful song, you will remember those days once more. Right? Maybe after our 10th class, when we passed the exam, that day evening night show we have gone to a movie, or maybe final year MBBS exam when we passed. After a few years, when you hear the same song, you will go back into the days of the final year MBBS once more. Array, that day night we have seen that movie and that beautiful song. So why do we go into the nostalgia on listening and audition? It is because of the medial geniculate body reporting to the amygdala. So doctor, in summary, this Brodmann classification system is very, very, very important thing to be remembered. Any question can come out of these areas. Numbers, you need to remember. Motor, speech, grammar, phonology is all because of the area 44. Then the auditory area, which is basically called transverse gyrus of Heschel, is basically 41 and 42. Then angular gyrus is 39. Visual cortex and occipital lobe, calcarine fissure, that is all 17. Then 312 is somatic sensory, post central, and 46 is basically central, which is motor area, is what need to be ultimately remembered. So what is meant by auditory radiation? Between the medial geniculate body to the transverse gyri of Heschel, how will be the fibers will be passing? They have to inevitably pass from thalamus. In thalamus you have medial geniculate body, and you have transverse gyri of Heschel in the cerebral cortex. So it has to pass through the internal capsule, no way. So posterior limb of the internal capsule, the fibers will be passing, which is called auditory radiation. Then transverse gyri, typically this is the area which is called auditory cortex. Primary auditory cortex is in 41 and 42. Transverse temporal gyri, it receives the information from the auditory radiation, and in turn it also projects to the area 22, which is the auditory association area. So ultimately, I told you, olivocochlear bundle. What will it be doing? Once more from the superior complex, fibers will go back and reach the cochlear nerve. Through cochlear nerve, the hair cells. So you have both crossed and uncrossed fibers in this olivocochlear bundle, and they arise from the superior nucleus, and they ultimately reach and project to the hair cells of the organ of Corti, and they will do what is called suppression of the auditory nerve activity. If too much sound is coming and everything is reported to brain can't bear all the sound now, so it must be suppressed, and that suppression occurs because of this olivocochlear pathway. So it is called as auditory sharpening is what you need to ultimately remember. So that is all the story, Doctor.